warm welcome to you. Thank you so much for accepting my invite. Hello everyone. We have Dr. Puneet Rana Arora with us. She's specialist in IVF and she's one of the famous gynecologists here. It's my honor to host her today, and we'll be discussing health issues and also how to break down the myths which is related to the woman after 40s. So we'll start with Dr. Rana. First, we'll start with her intro so that you guys know whom you're chatting with. Thank you. Over to you, Dr. Rana.
Thank you. Thank you so much, Vandana. And I really applaud and praise you for all the good work you are doing with your Soch Foundation. Such a noble cause, to help the needy. And, we can all, at least I can see the results of it coming out of it. So, hats off to you. And thank you so much for having me here. I am Dr. Puneet Rana Arora, as Vandana rightly said. I am an obstetrician and gynecologist as a profession, but now I specialize more in fertility and infertility. And I practice in Gurgaon. I have my own center under the name of CFAR, which is Center for Infertility and Assisted Reproduction. And I have been practicing infertility for the last, 15, 18 years. So thank you, Vandana, for having me here. And the topic I think Vandana chose is very, very important because, myself, post 40 and we are all entering into that phase at some point, so it's important to understand what exactly to expect when we reach that age group.
Absolutely, I agree with you, and there'll be a lot of women who are facing the same issues which we're discussing right now, related to fertility or related to the menopause or related to the hormonal disbalance which we face. So let's start, doctor. What is the main changes or any problems which starts with 40s?
So I think it's very interesting why we chose the age group 40, right? So I think that's very interesting, and thank you, Vandana, for choosing that 40. So let me make kind of a discuss why 40 first of all. As a human being, as a female, and we all undergo our stages of development, starting from being an infant to a small toddler, to a child, to an adolescent, and to an adulthood, and then finally to a stage where our body starts showing some changes. And 40 is that particular age, especially in females, where our hormones kind of start going away from us slowly, and they start to behave little differently, and hence this all brings in the body changes. As any developmental stage, the age of 40 brings in some changes for which we have to be careful, we have to be cautious, and that's why we are discussing 40. So to begin with, I would say the main thing is the hormones. So hormones can bring about irregular periods. The hormones can bring about problems in fertility. If a woman hasn't completed her reproductive age health, then obviously there can be problems in fertility. There can be problems with the bone loss. There can be problems with the vitamins deficiency. There can be problems with heart. There can be problems with alterations in the lipid profile, and they're all interlinked. They're all related to changes in the hormones. So I think if we understand the basic change in the hormone, everything is very much cross-linked to each other.
Now, my next question is, doctor, how does diet or the nutrition affects our body during these 40s, and what changes we should start adapting early so that we don't face more problems?
So I think, yes, the first and foremost is diet. I would completely agree on that fact, because diet is linked to other changes of the body. And and I won't say that hormones as such with the diet, but after a certain age group, our body digest food slower. What we say as our basal metabolic rate decreases. Maybe what we were eating at 30s, and if we are eating same at 40s, it may digest slowly. So we have to really watch what we are eating, but at the same time eating very healthy and nutritious diet. So I would say that, cutting down on the whites, like, carbohydrates, sugar, especially after 6 o'clock in the evening, because we know our basal metabolic rate is decreasing. So we should kind of cut down on the white things after 6 o'clock. I think that's easy to remember. I'm saying white because it's easy to remember, like white maida, sugar, or And what else? I mean, refined, anything refined is what white ghee, white butter is, these things we should avoid after sex. At the same time, increasing the physical activity, even if we, like I said, the basal metabolic rate increasing, but if we increase our physical activity, these things get digested easier. And the other thing is to compensate for the alteration in the hormones, to have good vitamins and minerals. A lot of vitamins and minerals come from fruit diet, vegetables, green vegetables. So we should increase our uptake of fruits, vegetable, nuts, but at the same time cutting down on carbohydrates.
And now moving on to some problems which, like you see, the fertility rate is decreasing with the kind of stress people are facing. And also that women are into professions which plan their baby in a delayed time. So what are your advice, and how does fertility comes into picture considering the nutrition and everything? And how does it affects the fertility rate of a woman?
So again, I mean, fertility, I would say it's all again comes to hormones. Because, we females, if we understand our physiology, we have two set of ovaries, and we are born with a certain number of eggs, and all the hormones come from these ovaries. So after certain age, like saying, I would say 33, 34, this number of eggs start declining. And hence, when the number of eggs decline, the hormone gets on a lower side, and hence the fertility. So because this is a limitation of a human female body, that we are born with a certain number of eggs which decline with age, so we really need to be aware on the fact that we look after it, right? So the way we look after our rest of the body, we should look after our reproductive health as well. And the way to look after is to make sure that if we know that we're not going to plan family or fertility, till the age of 38, 39, maybe we can freeze our eggs, because we know that the eggs are going to decline with age. So maybe we freeze it for further use. So that's the way we can support our body. Secondly, I would say that try to finish, childbearing early, and that's the best natural way. I remember in the old age, our grandparents and parents used to say there is a certain age group when the reproductive health is at peak, and that age group is between the age of 23 to 33, 34. So maybe try to plan a family at that time. But now I know that, we are all so busy with our work commitments, so we sometimes don't have time for this thing. But then for that, I would say freeze your eggs. That would be the best way to it, because this is a limitation that the eggs are going to go down with age. After the age of 40, the probability of pregnancy really decreases. And it's all interlinked with hormones and the eggs and the ovaries.
Very well said, doctor. Plan early to relax early.
Relax early, yes.
So, how do the women in 40s work on the long-term goals for the health? Supposingly exercise or yoga or adding some vitamins which food nutrition will not give us, for sure. So, some calcium or maybe some folic acid. How do the women work on that segment?
So I think, I mean, first of all, yes, the physical activity, the diet, and supplements. These are the three, I would say, key to keeping a health which is, I mean, kind of a active health post 40. So physical activity, I mean, increasing your physical activity to 30, 35 minutes, 40 minutes every day, along with some relaxations like yoga, meditation, would be a good way to keep yourself healthy. And not even, I would say 40, but at every age group, we should inculcate that habit. Little bit of aerobics and little bit of relaxation, a combination of them. Secondly, diet, very important to increase, because see, we always eat healthy, and I think majority of us are very particular these days about making sure we have enough calcium, enough minerals in our body, vitamins in our body. We try to eat healthy diet. But when we cross the age of 40, like I said, as the basal metabolic rate decreases, the absorption factor also comes to a little kind of a haywire nature. So to kind of absorb this minerals and vitamins in an adequate number, we need to increase the intake. So besides the diet, yes, supplementations we should start after the age of 40, especially the minerals, selenium, zinc, and vitamins like all multivitamins A to Z. They are good one to have. And above that, I would not say, I mean, hormones, we talk about it, but we only talk about hormones in women who kind of finish their periods before the age of 40 or at 40, so that we can supplement those artificial hormones, because hormones are responsible for bone health, heart health. So the supplements can be general supplements like vitamins and minerals, which are present in food, but just to add them up. And then there are supplements of hormones, but indicated in those who feel the symptoms of low hormones like hot flushes and night sweats, or who finish off their period before the age of 40.
Coming back to your specialty, doctor, a woman who is trying for a baby for more than 2 years or 3 years. So, what is the age you suggest that she should stop waiting and start for IVF?
Very nice question, Vanda. And I would say, because just practicing in fertility now, we see, couple who have been trying for 13, 15 years and not getting, anywhere. So I would say that yes, 2 years is the ideal, we generally say. I mean, 1 year, definitely, because 90% of women or couples do get pregnancy within 1 year of trying. But if it doesn't have, at least start meeting a fertility specialist after 1 year, and definitely meeting a fertility specialist if it doesn't happen in 2 years. Now, these is a broad, I would say, figure. But yes, if a woman age is more than 36, then even 6 months, delay is sometimes a big delay, because we know that our egg reserve is declining. So in those cases, age is a very important factor. In those age group, I would say meeting a fertility specialist sooner rather than later would be a good thing. At least, kind of getting some fertility tests done, knowing your body. And I think it's just empowering your body. So if there's something which needs to be corrected, at least we have time to correct it until it's too late. So yes, those figure of 1 and 2 years are good if the age is less than 36. But if it's more than 36, it should be sooner rather than later.
Very well said, doctor. And now coming back to the question, which is very important, depending on the Indian food we eat. So we keep ignoring the nutritionists and the dietitians. I have seen, and I've seen from many women, there is a question over there that the women keep avoiding these nutrition charts or dietitian counseling sessions, and the food we think is very healthy and it is giving everything in the diet. So, why a dietitian at certain age should be considered and should not be only considered if you are into a profession of a doctor or nutritionist or a modeling thing? Every woman should consider that. What is your thought about?
I think very well said, Vandana. So I think discipline in life is important. So if we have somebody, guiding us, we become disciplined. It's like, let's say the army life. Why people are disciplined? Because they have certain SOPs, they have certain protocols for everything. And the same way, if we have protocol for everything, we become disciplined. And that's why the guidance of nutritionist, dietitian, I feel is important, because they just bring you discipline in your life. They just guide you. We all eat healthy, like I said before, but when to eat, what to eat, and how much quantity to eat, they can guide us better. So I would say seeking help from a nutrition and dietitian, I would say it really, really helps us to eat right. And eating right is what is important. We all eat healthy, but I think eating right, is important, and that guidance we can get from our dietitians and nutritionists.
High time. You should not avoid them. You should not ignore that. Maybe I'll turn 40, then I'll go to them. I'll turn 30, then I'll go to them. We should not ignore. Importance of a dietitian is very important in the life which we are living and the food we are eating, especially in these festive times. So yes, I am also into that. Please follow a very nutritionist diet. Also, doctor, please kill certain myths of IVF, which women forms in their brain without knowing about it. So there's a question which is here, that what are the myths related to IVF? Will I gain weight? Will I be able to conceive normal after my first IVF or not? So what are the certain myths you want to kill over here in this chat session?
So I'll tell you what exactly, the questions which are asked to me by my patients when, when a decision is made about, advice is given about the IVF. So then that way I would say that the first of all, the question which comes to the mind is my child going to be normal like any other child born without IVF? And the answer is yes. IVF just assists, it assists with the kind of a having a child, but then the normality is completely like any other child. So we should not worry about that. Secondly, you rose a very important concept of a point of weight gain. This is the second most common question asked to me or anybody who comes to me who had previous IVF but not successful, that I have gained weight and also my periods have become irregular. So these are the two important questions which are also asked, and I generally answer in that way that IVF does involve hormones, right? And what hormones does is it makes us feel more hungry, right? So they do not have any direct effect on the weight, but they feel us more hungry. And like we just spoke about discipline. So if we had discipline, if we have a right, advice from a dietitian and a nutritionist, and if we eat right, the weight gain does not happen at all. So I think that definitely is a myth that the weight gain is because of IVF. It's not because of the IVF, it's just because of the hormones which can make you feel hungry. Thirdly, about the irregular periods. Now, see, I mean, infertility, I don't know whether how to take, there's a big debate going on whether it's a disease or not. Somewhere down the line, things are not right, and maybe couple have not been able to achieve pregnancy due to some reason. So that's why WHO has classed it as a disease, even though it's a lifestyle a factor that having a child, is important, but it's also a disease now. So from that point of view, I would say that yes, we should take it more seriously. If you're advised IVF, you should go at the right time, because IVF is also not 100%, but if done at the right time when advised, it's very important that you listen to your doctor and maybe go ahead with it. It's okay to take opinions, but not to delay it too much. So and then I think these are the main questions. Anything else, Vandana? You touched on this, on the myths of IVF. Anything else?
Yeah, there is a question which says some people are scared that whether too much of hormonal shots can lead to any kind of cancer or any kind of infection in the uterus or something.
So this is a kind of a debate which is going on in our medical field also, whether IVF drugs or even pregnancy leading drugs, medications can lead to cancer. And the answer is definitely a no, right? But there is obviously a limit to it. Now, I see patients who have been, because there's 3 steps of treatment for infertility. We just give general medications, we do procedures like IUI, and then IVF, right? So that's why when we say that, when I said that 2 years down the line, maximum you should see a fertility specialist, your exposure to fertility medication is small, and then the risk of any complication is less. But if you have been trying for 13 years and you have taken medication for 13 years or 15 years, then obviously you have taken it for quite a long time, which generally should not happen. And that's why I think I would really like to reiterate that, approach at the right time, because if it's not happening, I'm sure there's a reason, and the science has advanced that much that we can find a reason why it's not happening. So you should not kind of prolong your exposure to medications unnecessarily, but meet the right specialist so that you can be guided better and your time to pregnancy becomes less. You should be, if you have started trying today, you should be able to get pregnant in 2 to 3 years maximum, I'm saying, but not for 13, 15 years. You're on the same medications, trying on the same things. You should look for alternatives, look for options. And so hence I would say, if the exposure to these medications is for minimum, it does not at all lead to any cancerous thing or all. But yes, you should be cautious if it is 10 years, 15 years. We do ask our patients to keep an eye on it. Eye on it, I mean to say that, keep an eye, aware of your body, make sure you get your regular scans, yearly ultrasound scans, yearly breast examinations and all. But per se, I would say the fertility treatment, if given in the right way, does not at all cause a risk to cancer.
Thank you for answering that. That was the biggest myth in our mind of a woman, because there's a lot of anxiety which already a woman undergo when the baby is not happening. Also, doctor, there's a thing. people are being fooled in the name of a baby, right? You'll go to one doctor, then you'll go to one specialist, then another city you're trying again. So how do you say how much trial period for a woman? Because the more you undergo a treatment, the more stress levels are high. I am saying that with experience because I also have an IVF baby. You know that, and the reason I don't want any other woman keep living with a hope that no, tomorrow it will happen, or this treatment would be successful. So how many attempts or how many advices should be followed so that people are not blindly just getting their body tortured with these hormones and injections? So what is the age bracket they should try?
So very, very important again, Vandana. So thank you for raising this question as well. So, I mean, duration, let's say that even 1 year, 1.5 years, you've been trying naturally, it should happen. In 90% of the patient couples, the pregnancy happens. If it doesn't happen, step number one, go and meet your fertility specialist. Step number two, you will be most likely advised a workup, fertility tests, both for a woman and for her husband. Step number three, maybe you will be given a plan by your fertility specialist as to what is the best option for them, because it's very much individual. It all depends, the blood results or the workup shows what. Is it the problems in the uterus? Is it the problems in the sperm, which is a male factor? Is it the problems in the ovaries? Is it the problem in the tubes? So accordingly, a fertility specialist will make a plan for you. And these plans can be either just trying with medicines, which is the step number one. Step number two is kind of an intrauterine insemination, what we called as IUI. And step number three is trying for IVF. So I would say that if it is not happening, it should be stepwise, if provided everything is normal. Generally we say, okay, if you're going on medications, it should be for 3 to 6 months. If you're going for IUI, it should be for 3 to 4 cycles. If we are going for IVF, it should happen in 2 to 3 IVF cycles. So as long as, and as long as we know and the fertility specialist is in communication with you as to why it's happening and what can be done, I think it's normal to follow this protocol. So it's important not to have just medications for, let's say, 5 years, 6 years, be on the same medication. I definitely would not advise that. Move up the ladder. There are more options. Talk, at least communicate. There are a lot of forums like this. You are touching this topic so importantly and so nicely. So, go on these forums and talk to your friends, talk to others, so that you become, aware about your body, aware about what's going on, empower your body. And, that's the way to go about it, I would say.
Now, the last question from my end is, a woman plays a very important role in these fertility treatments. What is your advice for the male partner? Because he plays 10% and woman plays 90% role. So what is your advice for the male partners here?
So I would say if we look at the causes of infertility, Vandana, they do contribute 25%. Right? So we say that, when we enlist our causes of infertility, 25% is contribution from the male. There can be problem with the sperm, there can be problem with the number of sperm, there can be problem with the motility of the sperm, there can be problem with the morphology, how the sperm looks like. And then, there are a lot of other problems, maybe problems with, intercourse. All these things can happen. But I think in our society still the males do not come forward as a woman, because it's a myth that it's a female problem. So female is the first one to come forward and get herself checked. But then we do encourage them to bring their husbands, at least get the sperm tested. And I always encourage them to come together, let the male partner be involved in the treatment. And even if there is no male factor, but the support provided by the male partner to his wife, I think that's really crucial. Because like I said, infertility can be sometimes a social stigma, it can be an emotional journey. So the support is really needed even if there is no male problem. So it's a combined treatment of a male and a female, and it's just not a female treatment.
Absolutely, because I thoroughly agree that this treatment is like couple based. It's not an individual person should go for that stress, or with the hope the other person should also support equally. And it is very important for as a part of motivation to the woman. Yes, it will happen. Don't worry, I'm with you. That really matters.
That's right.
And last question of this session, which says, what are the effects of menopause, and what are the points which we can consider to understand that the body is changing and menopause is going to happen in near future?
Very nice, very good question. Thank you for that. So I would say that the menopause means complete absence of menstrual cycle or complete absence of periods. But before this happens, women undergo changes which we called as perimenopausal, which is around the menopause. And I think that's very important phase, because that is the time when hormones are going up and down, and we can feel all those symptoms of hormone variation, which can be in the form of getting little more irritable, getting night sweats, feeling more hot, hot flushes. So this is a time when we feel that our hormones are not right. So this is, I would say, the first phase. The second phase can be our periods become irregular. They may come early, they may come at a gap of 1 month, 2 months, 3 months, and then gradually they will stop coming. So that is menopause. But I think it's very important to look after the health from the perimenopausal period. Just feel what you are feeling. Like, are you getting any symptoms? Are you feeling differently what you used to feel before? Maybe good idea to check your hormones, because hormones can be checked. And from that time onwards, start looking after yourself. Become aware of your body. Give your body more vitamins, minerals, nutrients, and then start kind of a checkups, yearly checkup, maybe with yearly blood test, yearly breast examinations. Even if you can't go for any examination for breast, you just self-examine. Self-examination of breast is very important. Maybe yearly ultrasound scans to check for your ovaries if there are any cysts or fibroids or anything. So make a yearly plan. Get your pap smear done, which is a cervical screening thing. So make a plan for yourself: blood test, ultrasounds, breast examination, pap smear, and above all that, physical activities and a good diet. So these 5 things should be there in your agenda, so that you know what's happening, and then you can take action at an earlier stage and deal with it if there's any problem.
Okay. And I guess one more question is there, doctor, which is after menopause, how frequently a body checkup should be done?
Yeah, so it all, I would say, I mean, yearly. We can do it if you're very, very fit. We can leave it to, 2 years, 3 years. But I would say it's a good idea to do it every year. Doing the blood work, getting the ultrasounds, getting the breast examined, getting the pap smears. So I would recommend yearly checkup, not to kind of create a panic, but just, kind of knowing your body in a right way. So yearly checkups would be better.
I'll take the last question, doctor, and then we can close this. Will corona affect the baby growth, or and also normal delivery is possible in IVF sessions?
There are 2 independent questions, very important. So coming to the corona thing, so see, corona is a very new thing. It's been in our, I would say, in our kind of environment for the last 2 years. So far, it has not caused any untoward side effects. Initially, it was noticed that maybe there are increased risk of miscarriages with corona, and any women who suffered from acute corona symptoms. But now there are more promising studies coming up, but that it does not. I mean, I think the question was specific on growth, so it does not affect the growth. But having said that, it's just good to keep, do your regular antenatal checkups, get your growth scans done, because everybody is an individual, and still corona is teaching us a lot. Maybe the data which we have is from the whole population, the whole world. So I think still we need to individualize it. Get your regular antenatal checkups, get your growth scans. If there's any problem, meet your concerned obstetrician. But so far it has not shown much any effects on the growth. Second question was what was the second?
Whether normal delivery can happen in IVF.
And the answer is a big yes. I mean, IVF pregnancies, like I said in the beginning, they are like any other pregnancies. But yes, if the IVF, like any pregnancy can have a risk of hypertension in pregnancy, diabetes in pregnancy, that's an entirely different thing for indication. But IVF per se is not an indication for a cesarean section or not having a trial of vaginal delivery. Each pregnancy, should be given an equal chance of trying vaginal, because we know that vaginal birth is little more comfortable to a woman, even though cesareans have become very, easy ones and a good post-op recovery and all. But I would say, I mean, any other indications, medical is fine, but IVF per se should not be an indication for cesarean section. And women who have undergone IVF should definitely go a trial of vaginal delivery.
That was really a very important question which you have answered. Thank you so much. So we'll be closing the session now, because thank you so much for your time. And they were really important questions which you really answered, and the myths you have killed in this session. We'll hope to connect again with so many questions again, because the more science is going up, the questions are also going up, the stress level is up, and also the blog in the mind is there. So doctors are always there to be the best to answer this. Thank you so much, viewers, to give us a time, and your questions have been answered here. We'll connect again. Thank you so much, Dr. Rana.
Thank you.
All the best for your journey ahead, and many women like me would love to connect with you again. Thank you for giving time to Soch organization, and thank you for the association with us.
Thank you. Thank you, Vandana, for having me in this show. Thank you.